Dr. Centurion, great to have you back on Vital Signs again.
Well, it's a pleasure to be here with you, Brendon.
This RLS, Restless Leg Syndrome, is it a serious problem, would you say?
Well, it's one of these conditions that can range from being mild and just being a mild nuisance and annoyance for some people. But for many, it can be very severe and distressing. As you well know, we all need good sleep. And restless leg syndrome is one of the top 4 sleep disorder problems that people suffer from. And poor sleep can lead to anxiety, depression, and poor job performance, poor concentration. So those who have symptoms that are more severe or not well treated can certainly be very distressed by this disorder.
Does it always accompany insomnia? Do people have restless leg syndrome without having a sleep disturbance?
Well, most people that have restless leg syndrome, their symptoms begin oftentimes in the evening when they sit down to watch TV or have dinner, just when they're still, because it's a condition that comes on with stillness in the evening. But others, it just starts when they go to bed and they're lying in bed. And that's the typical time of onset. And for many, it can keep them from falling asleep because they feel this uncomfortable urge or compulsion to move the legs. Other people may describe it as a tingling, burning, cramping sensation. Some people describe it as an itch that you can't scratch. There's a lot of descriptions that people, how they describe it, but the underlying common denominator is that people have an urge to move the legs, and movement will help resolve the symptoms temporarily.
I think there's certainly enough to keep us awake at night already in this modern age. I know people who have dealt with this for years without getting any kind of relief from it. And it's, as you suggest, it's kind of this mysterious urge to move the legs often goes undiagnosed or misdiagnosed. And in the past, it's been seen as a psychological issue in some circles. Is that possible, Dr. Centurion? Could it be a psychological issue?
It is not a psychological problem. We do know that there are certain changes in the brain that occur related to dopamine transmission as well as iron levels in the brain that contribute to this disorder. That being said, like many conditions, stress could make it worse. And interestingly, and we may talk about this a little bit later, that some of the medications that are used for treatment do carry a fairly significant placebo effect. I mean, there's about a 40% placebo response in the treatments that we use, suggesting that there is some response that we're getting that's not related to the medication directly. Although, that being said, I would say that many times medications are very necessary and can be very helpful as well.
To see that full interview and others on how to optimize health, go to ept.ms/vital signs. Vital Signs offers general health information not intended as medical diagnosis or advice. Please consult your doctor before undertaking a new health regimen.